Senate Republicans' health care bill faces a critical test this week. There is supposed to be a vote before Congress goes on its 4th of July recess. But the newest Obamacare replacement does not have enough support. 5 of the 52 GOP senators say they oppose the current bill. Republican leaders need 3 of those votes to pass it because all of the Democrats plan to vote no. Nancy Cordes is on Capitol Hill. Nancy, good morning.
Good morning. It is a struggle, Margaret, because beyond those 5 Republican senators who have already said that they're voting no, there are others who say that they have serious concerns, and still more who are getting an earful from Democratic and Republican governors who worry about what this bill will mean for their states.
I want to see a bill with heart.
On Sunday, the president expressed confidence that GOP leaders will be able to adjust the Senate bill to win over holdouts.
Healthcare is a very complicated subject from the standpoint that you move it this way and this group doesn't like it. You move it a little bit over here. You have a very narrow path.
Moderate Republicans are balking at the bill's restrictions on federal funding for Medicaid, cuts being downplayed by the White House.
You keep calling them cuts, but we don't see them as cuts. It's slowing the rate of growth in the future and getting Medicaid back to where it was.
I have very serious concerns about the bill.
Maine's Susan Collins and Nevada's Dean Heller argued their states can't make up for the reduction in Medicaid funding. In Nevada alone, more than 200,000 people gained coverage under Obamacare's Medicaid expansion.
I'm telling you right now, I cannot support a piece of legislation that takes insurance away from tens of millions of Americans and hundreds of thousands of Nevadans.
But some conservative senators argue the bill doesn't cut enough because it retains a good chunk of Obamacare's tax credits to help people buy insurance.
Realize that the Obamacare subsidies in this bill are actually greater under the Republican bill than they are under the current Obamacare law. That is not anywhere close to repeal.
He's one of several Republicans who say the process is moving too fast.
There's no way we should be voting on this next week. No way.
I don't know quite why the rush. I frankly would like more days to consider this.
But Pennsylvania's Pat Toomey, who helped write the bill, says waiting won't make things better.
But I see this bill as a first step, a first important step in the direction of repealing those portions of Obamacare that we can.
In the absence of much support from the medical community, GOP leaders are hoping for a decent review from the nonpartisan Congressional Budget Office. The CBO has been crunching the numbers in this bill and should release its analysis as early as today, Gayle.
All right. Thank you, Nancy.